Good afternoon, everybody, and thank you for joining today's COVID-19 update. As of today, we have had 875,903 COVID-19 cases, 997 new cases reported since yesterday, 1,147 people in the hospital, and sadly, 11,552 people who've died. We continue to think about and pray for those who've lost loved ones or who are battling this illness. North Carolina's mission remains fast and fair when it comes to administering vaccines. Today, I'm proud to share that our state has fully vaccinated more than 1.1 million people. With almost 8 million adults in our state, there's more work to do, but this is a huge milestone. This puts us even closer to a time when we can hug our loved ones and gather without fear of severe illness. I'm grateful for the vaccine providers across our state for working hard to get shots off shelves and into arms. Your hard work is saving lives. We also continue to emphasize fairness in our vaccine distribution. In the last 4 weeks, over 20% of our first doses have been administered to Black North Carolinians. And we've again received national recognition for our efforts to administer vaccines equitably and report demographic data on our vaccinations. This weekend, North Carolina was recognized as the leader in the nation for reporting this data. We know that you have to be able to see the problem in order to fix it. And we'll continue pushing these efforts so that everyone, no matter what you look like or where you live, has a spot to get their shot. This month, even more schools are returning to in-person learning. And the State Board of Education and state health officials are emphasizing how critical it is to get students into the classroom. Getting students and educators in the classroom in person is a top priority. And I'm continuing to work with legislative leaders in both parties to ensure that happens safely. With children back in school and vaccine distribution well underway, there are more signs of hope that we are making progress toward putting this pandemic behind us. The percent of tests that are positive is consistently around 5% where we want it to be, and our hospital numbers remain stable. But this is not the time to abandon our prevention efforts. In fact, until the vaccine is widely available, preventing the spread of this virus must continue to be a focus. You know, there are times in football when the runner nears the goal line and begins celebrating too early and is stripped of the football. Let's not get caught celebrating too early. Let's keep wearing our masks and being responsible so that one day soon we can turn the corner on this pandemic. Tomorrow I'll visit the FEMA-supported vaccine site on its opening day in Greensboro. This vaccination center will run for 8 weeks and aims to give about 3,000 vaccines a day. I'm grateful for the collaboration among the federal government, state and local health officials, North Carolina Emergency Management, and the North Carolina National Guard, and others who've worked hard to make this happen. Despite the challenges of this last year, North Carolinians have never stopped showing up for each other. Healthcare workers have saved lives day in and day out. North Carolina businesses early in the pandemic started manufacturing PPE to help frontline workers. Educators kept students engaged even through video screens. Neighbors left meals for each other and families waved to loved ones through windows. This kind of compassionate resilience is what it means to be a North Carolinian and is what will help us get through this. We'll continue to monitor our progress with both our COVID-19 metrics and vaccine distribution to guide decisions about future executive orders. If we do this right, we will see even more progress as we move into the spring. I'll now recognize Dr. Mandy Cohen for a few remarks. Dr. Cohen?
Thank you, Governor. As the Governor said, getting to 1 million people fully vaccinated is quite a milestone. I'm so grateful I got my shot last Friday from the Wake County Public Health Team. They did a fantastic job, and I want to thank the great team running the site, especially Chrissy, who gave me my vaccine. My arm was sore, and I did feel a little achy that evening, but the reaction was mild and it didn't last long. I was able to get the one-shot Johnson & Johnson vaccine, so I will be fully protected after 2 full weeks. It's a great feeling of relief. One and done. I hope that all frontline essential workers will get their shots too. I had the honor of getting vaccinated alongside Reverend Dr. William Barber. He and I will be hosting another fireside chat this Thursday evening, and I invite you to join us as we continue our conversation about COVID-19 vaccines. The event will be live streamed on our social media channels. Our focus on equity is getting national attention. As Governor Cooper mentioned, this week, Bloomberg News recognized North Carolina as among the best performing states when it comes to distributing vaccines evenly among Black and white residents. I'm proud of our team for the progress we're making, but we know we have more work to do. We will continue to use every lever we have to ensure historically marginalized populations can easily access a COVID-19 vaccine. That includes how we allocate the vaccines, who we allocate vaccines to, which events we can support, where we deploy state resources, and who we engage on the ground to help address barriers like transportation and internet access. It also includes continued data transparency so we can hold ourselves and our vaccine providers accountable. That same Bloomberg article attributed our success to date in part because they said North Carolina is by far the best at collecting demographic data. Today, we expanded the data available on the public-facing dashboard. You will now be able to see week-to-week progress on how we're doing to achieve our equity goals, both at the state level and by county. New graphs share vaccinations by race, ethnicity, gender, and age, grouped by county, by week, and show trends since vaccinations began. We've also added information that show the number of 2-dose vaccines and 1-dose vaccines allocated and administered in the state. At the end of last week, North Carolina received about 80,000 one-shot Johnson & Johnson vaccine. As expected, the state did not receive new Johnson & Johnson allocations for this week, and we're giving vaccine providers more time to administer this first round of the J&J vaccine. And we likely won't have more of the J&J vaccine until really the end of the month. The good news is that the supplies of the vaccine are improving overall. We are fortunate that we have 3 vaccines that protect people from COVID-19 and most importantly, keep them out of the hospital and prevent death. Yesterday, the CDC shared some new guidance on ways those who are fully vaccinated, that means either 2 doses of the Pfizer and Moderna or taking the Johnson & Johnson vaccine, can safely return to certain activities. People who are fully vaccinated can get together with other fully vaccinated people without wearing masks and can gather with one unvaccinated household, assuming those who are unvaccinated are at low risk. It's important to note that people who have been vaccinated still need to wear masks when they're in public settings and around those who are not vaccinated. I'm looking forward to hugging my parents for the first time in more than a year. They are now fully vaccinated and will be visiting at the end of the month. If you're looking forward to hugging your loved ones again, I encourage you to get vaccinated when it's your turn. While we are seeing COVID trends moving in the right direction, cases and hospitalization numbers do remain elevated, and we still have work to do. With the introduction of new variants of COVID-19 virus that are more contagious, we need to safeguard our progress and keep protecting each other while everyone gets their spot to get their shot. So keep doing the 3 W's for now. Wear a mask, wait 6 feet apart, and wash your hands. Thanks, Governor.
Also with me today is Secretary of Public Safety Eric Hooks and Emergency Management Chief of Staff Will Ray. Cameron Larson and Monica McGee are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take questions from the media. If you will identify yourself and your organization, we'll take the first question.
Our first question is from Ashley Talley with WRAL.
Hi, Governor. Thank you so much for taking my question. Senator Berger just held a press conference about an hour ago saying that you all are working together on a potential reopening schools plan that would perhaps bridge the gap between what Democrats and Republicans and legislature have been talking about. What's your response to that?
Yes, we have been talking. I've been talking with Republican and Democratic legislative leaders, and we are talking about the best way our students can get back into the classroom. I think we all share the goal of getting our children back to in-person in the classroom. I think on February the 3rd, I stood here encouraging schools to go back in. We want to make sure that it is done safely, but our numbers continue to improve, and look forward, hopefully, to coming to some kind of agreement. I have not actually seen legislation yet, and I look forward to looking at that and hopefully getting to somewhere that we can announce soon. Next question, please.
We have a follow-up. Ashley Talley, WRAL.
Thank you so much for that. And as far as the numbers that you're referencing that continue to go down, we've seen states across the country, including just south of us in South Carolina, doing away with mask mandates and all of that. Is there a certain number or one of our metrics that you're looking at when you think North Carolina may make those changes? And what do you think of our neighboring states doing so?
We're going to listen to health officials, and health officials across the board continue to want to make sure that we have a mask mandate in place, that we wear masks to protect each other and ourselves. We're still working on getting people vaccinated. Our numbers are lower. That is great, and we need to keep working to make sure that our prevention efforts are in place. So we don't intend to lift the mask mandate in North Carolina, and look forward to even better numbers and more progress ahead as we get more people vaccinated. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Wanted to ask also about that Senators Berger and Ballard press conference. They were saying they're hoping that there'll be some agreement announced later today, and that it would be legislation that you would sign. Can you tell us where you are on that negotiating and the compromise to have the students come back?
Like I said earlier, I'm waiting to see legislation. I haven't seen it yet. I certainly want to reach agreement on this issue and hope we can soon. Next question, please.
We have a follow-up. Dawn Vaughn, News and Observer.
Can you say where the compromise is as far as if it's the having local and state emergency control, or if it's the Plan A versus B and allowing the districts to decide?
Can't talk about that right now because we are in discussion. As I said earlier, I've been talking with Democratic and Republican leaders in the state legislature. Our numbers are getting better. We want our children back in school safely, and we hope that we can have a compromise bill soon. Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. Given the nature of what you're discussing about phased-in reopening, there's been at least a couple of bills that have been introduced, one in particular about bars and restaurants, to allow them to fully open. Given your stance on those such bills back in 2020, have you had a chance to review and consider whether you would be in agreement, or would that be something that you'd be opposed to?
Well, we have an executive order in place that has bars at 30% capacity indoors and more than that outdoors with appropriate masking and social distancing. We're listening to the health officials and looking at our numbers. If we continue to make progress, we hope to ease restrictions in future executive orders. We're going to continue to encourage people to wear masks and be responsible, because that's the way we can keep our numbers down until people are fully vaccinated. So we're getting there, and I think when you look at North Carolina's numbers, and I think we've saved lives by actions that we have taken, and look forward to hopefully the legislature working with us to help get us through this pandemic, and hopefully we can get on the other side of this soon. Next question, please.
Our next question is from Sharon Van Zwieten with Spectrum News.
Hello, Governor. This is Sharon Van Zwieten from Spectrum News 1. Can you explain if the state has been hit by any of the shortages of syringes or other types of materials used in the vaccine process?
Dr. Cohen, address that.
Hi, Sharon. That's something we've been monitoring as we go along here. And no, we haven't seen syringes or other shortages of materials hold up anyone from being able to get vaccines out. What the federal government has done is change the needles that they've used to make sure that we can be drawing as much of that vaccine out of each and every vial. We're seeing our providers do that. So far, we have not had any issues, though it is something that we continue to monitor closely. Thank you.
Next question, please.
We have a follow-up, Sharon Van Zwieten, Spectrum News.
Hello again. This is for Dr. Cohen. Can you give us any guidance on when you might be opening up the vaccinations for children or people under age 21?
Well, thanks, Sharon. So there are several of the vaccines are able to be for folks who are under the age of 21. Currently, the Pfizer vaccine is eligible for those who are 16 and up, the other two vaccines 18 and up. The vaccines are right now going under more clinical trials for younger ages. They have not yet been approved for children, but they are being studied right now, and we're so appreciative that they're being right here in North Carolina, and we're appreciative of the those who have volunteered to be part of those clinical trials. So we look forward to seeing additional data. As you know, we are vaccinating folks according to priority groups. We're focused on those who are at highest risk of exposure and highest risk of having a severe outcome from COVID, which is why we've worked on vaccinating our healthcare workers, those in our long-term care settings, those over 65 and up, now our frontline essential workers who can't stay home to do their job, and coming next are going to be those who have increased risk because of a medical condition. And we are continuing to talk to our vaccine providers all the time about making sure that we are appropriately moving forward with due haste to get to all of our priority groups as quickly as possible. Thank you.
Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. First, for Governor Cooper, I was just hoping you could explain a little bit more about the phase 4 eligibility. I correct me if I'm wrong, but I heard Dr. Cohen say there's no J&J doses coming this week or next week. Do you anticipate that affecting the March 24th timetable for the medically vulnerable?
Well, first, we know that medically vulnerable who are 65 and over, who are essential workers, who may be living in congregate living, already have had an opportunity to get vaccinated. I think all the health officials want to move from one group to the next as quickly as possible, but I'll let Dr. Cohen address that specifically.
Hi, Brian. The J&J allocations were already factored into our thinking, and in fact, the governor and I were just hearing from our White House partners that we're going to be getting even a bit more of Pfizer doses as we go forward here week over week, so that's good news. And as a reminder that we are opening the site in Greensboro, that is a partnership with FEMA, that also brings in additional doses to our state above our allocation. We know the federal government is also increasing the number of doses going to our our retail pharmacy program, that's Walgreens and some of our CVS's around the state. So we are seeing supply improve, which is why we're going to continue to monitor to see how quickly we can move to Group 4. Right now, we are vaccinating our frontline essential workers, those who are over 65 and up, but we will continue to monitor that. And the latest we would go is March 24th, but we would look to see if we could move that up sooner. Thank you.
Next question, please.
Our next question is from John Evans with WECP.
Governor, thank you for taking the call. I guess this would go to Dr. Cohen. You mentioned, Dr. Cohen, about the future shipments of the J&J vaccine and Pfizer. Do you have numbers on exactly how many doses of the Johnson & Johnson and Pfizer might be coming to North Carolina when those new shipments come in, and how it might allow expanding some of the mass vaccination clinics that go along with it? Thanks so much.
Well, thanks so much. So as of right now, starting this coming week, and remember the vaccine week starts on a Wednesday is generally when we get our shipment of vaccine for the week, if you will. So Tuesday night into Wednesday. And we're getting now about 225,000 doses between the Pfizer and the Moderna doses of vaccine. That's first doses only. Again, second doses come on its own schedule according to the time that folks are supposed to get their second dose. So we're getting 225,000 first doses, but that's just to our North Carolina providers. On top of that, we know there is going to be some amount of a J&J allocation. We got 80,000 doses last week. We know we're not getting any this week. We will see if we'll get just very small amounts in the coming weeks. And then we were reported by the federal government that the Johnson & Johnson vaccines will really ramp up once we get into April. So we're already planning for that. But remember, in addition to the first doses, as I was saying, that we get here to North Carolina that we then allocate out to providers, there are some additional doses coming into our state. They come through, for example, the retail pharmacy program and go directly to our Walgreens and some of our CVS locations. They come in and go to some of our federally qualified health centers directly, and they are going now to this new partnership with the FEMA site in Greensboro. Again, they're going to be doing about 3,000 vaccines a day. So all of that improves our ability to get supply out to the folks in North Carolina. We're going to keep pushing to make sure we're getting out things fast and equitably. Thank you.
Next question, please.
Our final question today will be from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek Dellinger with Fox 46 in Charlotte. You mentioned the numbers and the equity aspect of this that you guys have been touting, but there has been one demographic here that's kind of been lacking in some of this. We noticed this on the dashboard. Low vaccination rates among the state's Hispanic population. It's only 3%, and they make up about 10% of the population. We know that, at least on a state level, as well as especially here in Mecklenburg County on a county level, there has been a lot of outreach to the minority communities, and especially the Latinx community. What do you think is the lingering reason for the hesitancy that's going on here, and what is being done additionally to address that? Because I know you guys have been doing a lot to address the Latinx community over the last year.
Well, thanks for the question. And first, it's important to point out that you can't know about a problem until you can see it. And I credit the Department of Health and Human Services, Dr. Cohen's team, for making sure we built our own database so that close to 100% of the vaccinations that we administer, we know race and ethnicity. There's been a lot of work to try to reach out to communities, community leaders, community groups, and there has been strong intentional effort. That number needs to get better. I'll turn it over to Dr. Cohen and let her tell you about some of the specific things that are going on.
Thank you, Governor, and thank you, Derek, for the question. What I would say is with the new information you can see on our dashboard today, you can actually see we are making progress week over week. And this past week, we were able to reach a larger percentage of our Hispanic community. We had been about 3% of vaccines were going to our Hispanic community. We know they make up about 9% of the population. But last week, we jumped up to 7%. So that's we're getting better. So we're more than double where we were just a week ago. So already making some progress. But we know as the governor said, we have more work to do. But that data helps us drive our decision making. And I think that what you're going to see is particularly a lot of partnership with a number of business employers. Particularly, we know that are around that are able to work with us and do some of the vaccine clinics that are reaching out specifically to the Hispanic community. I think it's really important that we also have language access, and so that has been a particular focus. And I also want to thank all of our partners who have really stepped up and helped us raise awareness. I was joined by a number of partners to do an all Spanish language fireside chat last week, which I think was great. And we're going to continue to do that because it does take time. We want to answer folks' questions. We want them to understand that vaccines are safe, but we also want them to know that their information that they give to us at a vaccine event is private, and we do not share that with any immigration officials. So there are a lot of things we want to make sure we're answering folks' questions as we go through. Thank you.
We're also working with leaders in our American Indian population to increase uptake of vaccine there. So we're going to continue making sure that this vaccine gets across our state in rural and urban areas, all 100 counties, all parts, all people. We want to make sure that North Carolina gets vaccinated as quickly and as fairly as possible so that we can turn the corner on this pandemic. Thank you all for joining us, and stay safe out there.